So we have a very interesting case. It's the first time for me, certainly. 32-year-old gentleman came in for a routine skin check, and he has a lot of irregular moles. We call them dysplastic nevi, and nevi, again, is the plural for nevus. And these are just pigmented moles. The common terms are just moles, but he has dysplastic, meaning they're irregular. If you look at his back and look at his trunk, his moles are not regular, they're not evenly brown. There's a lot of irregular borders. Some are very dark, some are unevenly brown. So he's definitely 10 times more likely to have malignant melanoma. So we ended up biopsying two that were most suspicious. One on the mid-back, as you can see, that was a little darker than the rest. It was irregular. And then one on his sideburn area that was a little bit irregular also. And both of them turned out to be malignant melanoma. So it was very surprising, unfortunately. And when I have cases like this, I definitely want more than just one dermatopathologist to look at it. And so we had definitely more than one. There was about 4 or even 5 dermatopathologists that looked at it, that did special staining, and they all concurred, they all agree that both of them are malignant melanoma. So unfortunate for this gentleman, of course, but fortunately we caught it early. It's still the early stage. It's more than the in situ, so it's gone a little deeper. But we have to do an excision with a 1 centimeter margin, so we're going to do that. And then we're going to refer him to MD Anderson for just follow-up. They'll probably do this routine screening for all malignant melanomas. And he has some other lesions that are suspicious, and I suspect that they will probably biopsy some other ones, and because he has a lot of irregular ones. He doesn't have a family history, but just because you don't have a family history doesn't mean that you're not going to have it. If you have irregular moles, you got to see your dermatologist. If you look at the one on his back, you will notice that it's not raised. And the majority of his moles in the back are not raised. One of the biggest misconceptions that I hear from patients coming in is that they think that moles are worrisome only if it's raised. It's not true. Malignant melanomas are flat. When they're raised, that means they're very thick, and that means it's kind of late. So don't wait until your moles are thicker and you can feel them before you go see your dermatologist. The one on his sideburn is raised, okay? So there's a lot of factors we take into. We take into, the ABCDEs, the asymmetry, the borders, the color, the diameter, moles that itch, moles that gets irritated, So these are things that we all put together, and it's hard to know which one to biopsy when you see a patient like this. I mean, you look at his back, like a lot of them look worrisome. So these patients, they can be hard to manage. I mean, now that he has 2, we're definitely going to be more aggressive. I assume that they're going to be excising and biopsying a lot more. So anyways, I just want to share this very interesting case. 2 melanoma found at one time in a 32-year-old. And my patient who has melanoma, they're getting younger and younger for sure. They've had sun exposure. So actually, for his age and demographic, the #1 cancer is melanoma in young patients. So you got to make sure that you have irregular moles that are changing. Please go see your dermatologist. All right?